We want to pick up where we left off.
That's right.
Before lunch, when you all have now had fuel. Hopefully that has fueled your mind, your thinking about the real, like what do we really need to get into? And we actually made some modifications to the agenda to give this a little bit more space and room before we move into the next thing. So those of you who are on the panel, we're going to push this a little bit later. We will still get to you. We're going to give a little bit more room for this conversation. So I don't know, Anita, if you want to get us started with observations and or questions based upon where we ended off for lunch, and then we will be looking around the room for, if you would like to say something, you want to get into it, raise your hand, we'll get a microphone to you.
Well, I think this really started in two pathways that were led by Jennifer and Dr. T, which is fundamentally what has to change today to make real difference in the lives of people in this country. Whether it's today that we commit to some plan of action in terms of our work together, our expectations for the organizations that we sit in, whether it's something that we're going to do differently, that can actually result in the meaningful change that Dr. T identified. Earlier today when we were talking in the keynote, I was saying, does it add up to anything that's going to actually result in improvement? And I think the question for all of us is, what are those practical changes that we can identify today that's going to make that different narrative real? And some of that is to Jennifer's point and others about that trust pathway. How are we building different relationships? How are we sitting together in new ways to result in some of that positive impact that we need to see? I think I might have said 3 months in my earlier comments. Whatever suspense you want to take it, but families and communities are challenged today. And so what does that look like?
So I'm curious, like, who wants to jump in with thoughts, observations, challenges? Let's get into it. What's it going to take to make a real difference? And I have done a poor job of this up to this point. It'd be great if you would introduce yourself in a sentence or less.
Sure.
When you start off.
Steve Wolf, Virginia Commonwealth University. I think that this is hitting on like a really key thing. Anita's presentation talked about the need for transformative change. Tiffany, at the beginning, I think, made a very eloquent point that 99% of what we need to do for that transformative change is about how to build political and public will. And it seems to me that that means our big obligation, I think we know a lot about policies and the epidemiology and so forth. Our big obligation is think about changing our framing and our message. So that's part of it, is how do we talk about this in a way that speaks to people? I think when we had our small groups this morning, one of our suggestions was to drop the word health altogether, because we already know that the social determinants of health will improve health outcomes. So making it about the things that are Tiffany was talking about that people are confronting in their daily lives is a way to meet people where they are. So part of it is framing. And then the second part is, who's the messenger? We did some focus groups at our program with Republican lawmakers, state lawmakers from different parts of the country. They gave us lots of good advice about how to think about our messaging in a way that's not going to shut down conversation right away. And one of their pieces of wisdom was, you guys are not trusted. So it's fine for you in the public health community to conceive of these ideas and marshal your evidence and so forth, but especially at the local level, it's the faith community, it's trusted members of the community who can be more effective at delivering the message. So I think the combination of reframing our message and then thinking about who should be delivering the message might help move some change.
Thanks.
Steve, can I ask a question, or for the group to open up that question? I think the point of trust and who's conveying the motivations behind health and well-being makes a lot of good sense. But you were also in a conversation nationally about things that we know are absolutely central to health drivers: structural racism, systemic racism, health inequities. How do we move the conversation in ways that will be accepted in terms of change, but not paper over some very clear points of conflict and tension in our ability to actually move the needle in terms of health and well-being? Because we constantly have these conversations over many decades and years where we take 2 steps forward on some of these foundational root driver issues for health and well-being, whether it's people's access to good paying jobs, whether it's environmental justice issues, whether it's something else. And yet then we have this conversation that from some corners might water down the actions or the policies. How do we do that, acknowledging the narrative that is our U.S. conversation today?
Were you going to start? That's all.
Yeah, I'll start, but I'm really interested in what others have to say. I think the first part of your question, I'm optimistic about the idea of trying to align interests around shared interests, of trying to get ahead. For people who feel like they're being left behind and that there's uneven opportunities, to try to frame a message around what do we need to change to improve conditions for our future. The notion of invoking children, I think, can be particularly effective. Our children are destined to live shorter lives than we are, or our parents were. They face more difficult economic opportunities, more challenges for social mobility. That's something that I think conservative and progressive parents can relate to. So I think there's ways of engaging people around that. It's not easy, but I have an easier time envisioning a campaign that pulls that together. I was telling Martha, growing up in the 60s, I remember Bobby Kennedy's campaign, and the people that he aligned in his political constituency were today a combination of what would be Trump voters and voters for Barack Obama. They were all behind him because he was framing a message that I think they could all relate to and get behind. But the other issue you're bringing up, how do we deal with systemic racism, gets to the core issue of a belief in a hierarchy of human values. And that, I think, that's a really bigger issue to resolve than messaging. So I'm interested in the wisdom of other people in this group of how do we change hearts and minds around that if people are steeped in that kind of belief system.
Jane, I don't know if you were going to respond specifically to her question.
I can try and do a little bit of both.
Come back to you, Robert.
Jane Erickson with Rethink Health. And so I think building on what you shared and taking a page out of Dr. T's new book is, and kind of aligned with this idea of having an asset orientation, is shifting away from framing the task at hand, from solving a problem to actually creating a new future, and one that everyone can see themselves in. It's really notable that this whole session is about shifting investments, but we are actually talking about shifting values. Of course, investments are a reflection of what we value, and it's really notable that this conversation is ultimately about culture change and what it actually takes to do that in a way that sticks. And when I reflect on a lot of the through lines in our little kind of breakout sessions and conversations over lunch, it does come back to what it takes to build, in Dr. King's world, a beloved community. And to do that in the face of, extreme polarization and leaning more into difference than commonality.
Great, thank you. Bob.
So I'm Bob Kaplan from Stanford University, and I have to preface this comment by saying that this deals with it's just a sliver of how we approach things, but it comes from the world that I live in, which is research universities. So, and I owe part of this to a discussion I had with my UCLA colleague, Neil Halfon. So, I think that the purpose of great universities is to solve societal problems. If you take something like homelessness, for example, to tackle that, there's a medical component that medical school should be involved with, and a legal component, and a sociological component, and it goes on and on. So none of those units can deal with it by themselves, but collectively they can approach it. But I think that our universities are not structured to do it. So in universities, we say there's 3 pillars. There's research, teaching, and community service. And that's how faculty are evaluated. But we don't really know what community service is. So as faculty are evaluated, it's did you serve on some committees, and did you review papers for journals and so forth. And so Neil and I talked about, well, maybe we have to rethink what universities' missions are, and particularly that community service component. And maybe it should be societal impact. And so when universities are evaluated, or when faculty are evaluated, you don't look at how many committees they served on, but they should be looking at whether or not the work they're doing has an impact on these sorts of issues like we've been discussing.
So I see a hand up. If you could pass the mic down, that'd be great. I do want to push us a bit, engage us a bit, challenge us a bit about that real, and about the effect that it has on, I think we said the people at home, but that, we can define that any way we want. So here's one way to think about it. I graduated high school in Compton, California. That means that at one point in my life, I was young, gifted, and black. I was an urban youth. I was an opportunity youth. I was a disadvantaged youth. Like all the academic words to describe my experience had nothing to do with my experience. My experience was, how do I get out of high school and get into a college? Like, how do I survive literally both the things happening, quote unquote, in the streets, right? And the fact that a friend of mine died because of an asthma attack, because that's what happens in the real world. While we're, and I moved on, I've done health policy, like I ran a health foundation, like I've about as ivory tower as you can get. There's no pointing fingers here. It's merely like how do we get it from the theory to the bench, right? How do we make that translation to the real world in what we're talking about? Like, we may need to use the academic terms to make sure we're on the same page here. And like, what does it mean in the real world for the people we're trying to address at some level? Like that, we got to be able to dance to both of those tunes. Right?
One thing I just want to add to that, and before you talk, the question I would throw out to the group is, are we making it more complicated than it needs to be? Quite simply, right? Do we know the factors that matter, and how would we simplify this tomorrow to get to the real? But sorry, go ahead.
Yes, Jason Brunel, James S. McDonald Foundation. I think of this on 2 tracks, and I want to bring this back to racism and race, which is central to the founding mythology of the country. I think you have to wrestle with the fact that it's not some accidental, ancillary, exotic notion. You go back to Bacon's Rebellion in 1676. Where African indentured servants and English indentured servants rise up together to overthrow the colonial government. And that's when you see slave codes. That's when you see dividing people in very systematic and on-purpose ways. 100 years before the revolution. In order to change that, you've got to redraw the boundaries of the in-group that is included in what we say when we use the word we. We've used the word we a lot this morning. Not all of us are included in we. And in order to redraw the boundaries of that in-group, you've got to begin to put people in situations where they feel that their goals are aligned with other people. The social psychology literature is pretty clear on this. You create new in-groups by giving people superordinate goals that they can work on together, but they have to meet each other as people. We have to agree that we're all human, and that's not an agreement that we've got right now. That's long work. The real is, let's start moving resources now to the places where we know that they're needed. I'll give you a prime example. Before I took over this foundation, worked in healthcare, and we said, we're going to move a significant part of our bank deposits into 2 financial institutions, and we expect you to do lending in a 22 zip code footprint that's majority black and at least 20% poverty rates. That's real. Like, we expect you to do mortgage lending, we expect you to do small business lending, we expect this to accrue to the benefit of this community, and we're going to put real dollars behind it. I don't have to wait for hearts and minds to change in order to move that money. So we can do that today while we're doing the longer term work of really having a conversation about what do we mean when we say American, and what do we mean when we say we. And that's harder work. That's a kind of reconstitution of the United States, which for all his flaws was actually what Jefferson had in mind. He thought we'd redo the whole Constitution thing every generation and not create this sort of sacrosanct document, but evolve into this more perfect union that we talk about.
So I know we have some thoughts. Thank you so much, Jason. I know we have some thoughts from folks online. Fisher, you want to bring some of those voices into the room?
I'm going to see if anybody online wants to represent their own voice, so I don't have the pressure of trying to summarize what's a pretty uncontainable conversation. Anybody online want to offer any reflections? Oh, they're just going to let me out here to dry.
Yep.
Ellen, there's Ellen. Ellen, thank you, Ellen. Amazing. I think we can hear you, Ellen. Can we hear you yet? Hold on 1 second, Ellen. We're not hearing you just yet. What do we need to do to make this happen? Try again, Ellen, real quick.
All right.
Yeah, we're going to figure this out, Ellen. We will figure it out.
All right. In the short term, do you want to work on that and then
Yes.
come back to us? And
Yep.
then, all right, great.
Can I ask a question to follow on Jason? I mean, Jason, you're representing the philanthropic sector, foundations. I mean, what do you think it would take for that covenant to be more widespread, right? That commitment across, because we each are in some ways representing different sectors here today that all have to do something today. And I'm curious where you see the opportunities, either in that sector or others want to speak about their sector, or the barriers that are not going to allow that decision to happen.
And at risk of complicating that question further, this is where I think this interplay between policy and action, because we have the Community Reinvestment Act. That happened in the 70s. It was supposed to do the thing you just said you as a private institution had to choose to do. So the policy exists. That's what the banks are supposed to do, right? They're not supposed to be able to open another branch, do a merger, do an acquisition. Like, they're supposed to be evaluated on this on a regular basis. And yet, in order to make it happen, it was a private institution's choice, as opposed to like this overarching policy decision that had been made, again, decades and decades ago.
Say we did have financial institutions who were, like, that was their intention, to direct those resources in that way. The 2 financial institutions we were working with were doing that on purpose. But to your point, equity doesn't happen on autopilot. It never has, it never will, unless we make intentional choices as institutions, as actors within institutions, to direct resources in intentional ways. That's the only way it works. And I'm proud to say in St. Louis, we were part of something called the Anchor Action Network, which was 16 anchor institutions who've made the same commitment to hiring and purchasing in that same 22 zip code footprint. And it's hard work, but it's something we've come together to collaborate on. And it's on purpose. But the only way you're going to reverse engineer the on-purpose things that were done to exclude people from opportunity is to do things on purpose in the opposite direction.
Yeah. Okay. Yep. All right. I got a hand up back here.
You had asked earlier about what did we need to do for transformative change. And I think it's that trust walk that Dr. T talked about earlier. And we heard an example from Washington State where I believe it's Jennifer. Jennifer talked about the trust walk that Washington State's group took with her that brought down barriers. And I think we need to be spread. That's something all of us could be spreading right where we are, is inviting people in to do trust walks with us. And how do we bring barriers down with people who are not necessarily in this conversation? Jennifer, I applaud you for being here and for Washington State, having you here and you leading the way with them. So where are we doing that elsewhere? And then the second thing that I heard that I think we could do is, Anita, you said, is that right now we measure and focus on deficits. Where would we be where we took our social contract and we measured our ambitions and dreams, and what can I expect from you and, what can you expect from me? That's something that we can do. We can begin to change the narrative of what we're going to measure and quit looking at deficits.
Are there other examples to this conversation that people are seeing some structural changes that could be done in the near future, either in your representative organizations or just like we were talking about with the Community Reinvestment Act and banking and philanthropy? Are there other examples like that that either you're a part of or could see happening in the near term?
I'm Paul Hughes Cromwick. I work with a gentleman who invented the term healthy village. What it does is it takes a safety net hospital that has excess capacity, that is having financial difficulties, and there are many of these across America, and keep some of the hospital functions open, the ER, bring in primary care and behavioral health, but then most dramatically bring in partners that each address the social determinants with what he calls Main Street. Think about a mall instead of a hospital where you get these needs met because of the purposeful selection of those tenants, those partners.
Thanks very much. Yeah, go ahead.
Sure. Tyler Norris, currently visiting scholar at the Federal Reserve Bank of New York and previously the CEO of Wellbeing Trust. I want to go, Anita, to your pragmatic question, what's happening, but first I want to address trust. 35 some years ago, with the help of Michael McGinnis and all, when we were first starting to do Healthy Cities, the Colorado Trust put aside $10 million to support 30 communities in doing something special. And we did extraordinary work on food systems and what today we might call complete streets and all kinds of really good things like that. Doug Easterling, who some of you may know, was the evaluator now at South Carolina. The single most important ingredient to the success of those 30 communities that created all these kinds of outcomes turned out to be the potlucks. It was the breaking of bread. It was the getting to know each other and understanding that your fate and mine are intertwined. Your children and mine are intertwined. And I've been thinking about the beautiful way, Dr. T, that you started us off this morning. It's all about, we have all the resources we need, the asset-based approach. We need to liberate these trapped assets. And we have the evidence base. We're in the halls where that gets articulated. So where's the trust? It's in how we see each other. Who am I in relation to you? Our wisdom traditions teach us to love one another as ourselves, not in some transactional way, but literally as ourselves, to embrace this. And so I just want to say, in a very pragmatic way, all of those meetings across the state all just started with breaking bread, companionship with bread, like, with each other, because that was the font of social capital: trust, reciprocity, cohesion, all the things that we could and move forward. So I just wanted to put that. Second, I want to come to kind of what I'm working on now, and Jason builds really on this. The Bank Community Reinvestment Act, coming out of War on Poverty, started from a very different place as community benefit. I mean, different actors, different places. And you couldn't find two more aligned pieces of need, because what it means is that a health system, with its grant making, alongside its anchor resources of leveraging its purchasing and its hiring and its investment portfolios, partnering up with the community development finance institutions to do what they do, is to bring capital and really bring that together. So the finance institutions, the health systems, and CBOs, community-based organizations, have the ability to not just tinker with 2- and 3-year grants, but to actually build out food infrastructure, housing infrastructure, early childhood development. And I'm going to suggest, as we see those grow across the country, and it's kind of what we're focused on at the Fed right now, that is what puts in place the infrastructure for youth potentiation. And I'm with you, Steve. I think that's exactly right. A year before birth, health of women and girls, through a trajectory of potentiation that we know well, from the brain development to nature and nurture, all the way to a service year, like Governor Wes Moore is talking about right now. That kind of a trajectory of potentiation, which links what we know here, is enabled through those kinds of partnerships, and when rooted in place, they can get done. And I think much of it is a local and regional piece of work that it's harder the further you get away. But as a person who mostly a community person who just ended up with jobs that have been more in philanthropy over time, that's the home, back where healthy communities began, of people coming together from different walks of life with shared fate. And so I'm going to suggest that we build trust there and we get things done there.
So we're going to check in with the folks online. Atul, after that, I think I'm coming to you. So is that still good with you? You and the panel is coming up next?
Sure, why not?
All right, so we're going to check in online. Fisher?
Yeah, we're going to try one more time. People online are hearing each other, and so I don't know what's happening in the room. So, Ellen, I'm super sorry if this is the case, but we're going to try once more.
Okay.
To see if we, there we go. We just heard something.
All right.
Yes, awesome.
Thank you for problem solving. Well, there's a lot in the chat, and there's a lot been going on since I gathered my thoughts a few minutes ago, but some of what I'm hearing is that health is ensuring vibrant and thriving communities. And so we need to think about the health of our communities and of our society, get out of some of the individualistic mindset. To get there, we have to stop talking at people, stop telling people what to do, stop labeling people. We need to start listening and think about our role in the various organizations and institutions where we sit, of earning trust, recognize that as a responsibility, that it should not be given. And we have to do this work together, all of us. So that means those of us in the room and all of the people in our communities, like see ourselves as part of those connected communities and work together.
So we are going to do some of that connecting. Thank you all so much for engaging in this part of the conversation. We will have more conversation together.